Welcome to Open Enrollment. Here are a list of items that we will review today: the medical changes, dental, vision, and some voluntary options. Open enrollment started, and you have until December 14th to return your enrollment packet. As a reminder, all employees that have met the pre-eligibility criteria are eligible for benefits, aside from yourself, legal spouse, domestic partner, and children up to the age of 26. The benefits that you will review and enroll in are effective January 1, 2021 until December 31st, 2021. You cannot make any changes to your plans unless you experience a qualified event. Some of those events are birth, marriage, divorce, birth of a child. You have 31 days from the date of that event to contact your HR team to potentially make changes. We will go over the benefits. The medical plans. You have 4 plans to choose from. First plan is a PPO 2500. That is going to be your individual deductible. Your family deductible is $5,000. On this plan, your deductible comes into play with major medical services, surgery, hospitalization, MRIs, CAT scans, things of that nature. If you meet that deductible, you will go into the cost share and you will pay 20% of all costs of those major medical events until you reach your out-of-pocket maximum of $6,350 or $12,700. On all 4 plans, your preventative care services are going to be covered at 100%. So age-appropriate screenings, immunization, lab work, those will all be covered at 100% with no out-of-pocket costs on all the plans. On this plan, your office visit, sick visit, walk-in clinic is going to be a $35 copay, specialist $60, urgent care $75, and emergency room $250. You also have copays for prescriptions before your deductible. Generic is $10, brand name $35, non-preferred brand name $60 or $120, and then you have 4 additional tiers under specialty. The next plan is a high deductible health plan. This is a $3,500 individual deductible, $7,000 family deductible. On this plan, all services are subject to deductible. Doctor visit, specialists, MRIs, CAT scans, urgent care, everything with the exception of your preventative care services, preventative drugs, and FDA-approved contraceptives. If you enroll in this plan, you also have the ability to open an HSA account, or if you already have one, continue to contribute towards your HSA account. And we will go over the maximums for the 2021 plan year in the next screen. 2 more plans to go over here. So this first one is a PPO 6350. That is going to be the individual deductible. $12,700 is the family deductible. If you met the deductible, you've also met the out-of-pocket maximum, and you're covered at 100%. Again, both of these plans have preventative care services covered at 100%. Your office visits on this plan is a $25 copay, specialist $50. Your urgent care is $75 per visit, and emergency room $250. Keep in mind on both of these plans, if you go to the emergency room and you have to spend the night, that is going to trigger your deductible. Generic drugs, $10 copay. Brand name preferred, $35. Brand name non-preferred, $60 or $120, and again, 4 more tiers under specialty. The next plan is a PPO 6500. This plan is in the Alliance Network. So the first 3 plans are going to be in the PPO National Network. The last plan is going to be in the Alliance Network. Again, 6500 Alliance. The deductible is $6,500 for the individual, $13,000 for the family. If you met the deductible, you've also met your out-of-pocket maximum. Preventive care services, again, covered at 100%. Your doctor visit is $30, specialist $65. Urgent care, $75, and emergency room, $250. And again, keep in mind, if you access the emergency room services and you have to spend the night, that is going to trigger your deductible. Prescriptions are the same, so $10 for this generic, $35 copay for the preferred, $60 or $120 for the brand name non-preferred, and specialty drugs, again, 4 more tiers. Blue Care Anywhere is going to be your new telemedicine provider. So they're going to provide medical, counseling, and psychiatry services with zero copay until the end of the pandemic. And that is for yourself and anybody enrolled in any of the Blue Cross Blue Shield plans. You will get additional information to the Blue Care Anywhere with your welcome kit once you receive your ID card. Your dental plans, no changes in the plans or the premiums. So the first plan is a PPO base plan. You have $1,500 to use towards your dental services for yourself and any family members enrolled in the plan. You get another $1,000 to use toward child orthodontia. On this plan, your preventative care services are covered at 100%. Your basic services, which are going to be cavities and emergency extractions and services, 80%, major services, 50%. Now, if you use the basic or major services, you will be subject to a one-time deductible of $50 as an individual or $150 as a family. The next plan is a DHMO plan. Now, in this plan, you do have to pick a primary dentist. You can change the dentist at any time. If you're enrolling for the first time and you do not select a dentist, Delta Care USA is going to assign the dentist to you based on your home zip code. But then again, you can change at any time. On this plan, your preventative services, again, covered at 100%. Your basic services, major services are all going to be fees at a fee schedule. There is no annual maximum on this plan, and there is no deductible on this plan. All services, basic, major, and orthodontia for children and adult are covered at a fee schedule. So this is what the fee schedule looks like. You find the dental code with the treatment plan that you need done, and the dollar amount associated with that is what you pay. So use your dollars to pay for these services. Your vision plan, no changes to the vision plan. Everything stayed the same, including the premium. So your eye exam is every 12 months is a $10 copay. Your frames, you have a $120 allowance towards the frames. Single vision, bifocal, and trifocal plastic lenses are a $10 copay. Contact lenses, you have an $80 allowance to use towards your contact lenses. And medically prescribed are going to be covered in full. Life insurance, some changes here. So if you have life insurance today with Unum, you do need to complete a new MetLife form. Please indicate if you'd like to keep the same coverage, increase it, or if you want to remove the coverage. So everyone should get a MetLife form. Please fill in your name and don't forget to fill in your beneficiary. So the new plan, all employees working 20 plus hours are now eligible. It's still 5 times your annual earnings up to $500,000. The guarantee issue is 5 times annual earnings up to $200,000 for all new employees or newly eligible. Spouse guarantee issue is $25,000 and children is $10,000 and always going to be a guarantee issue. Your benefit reduction schedule is none. So there is none with MetLife. That's a change from today's Unum. Short-term and long-term disability are also going to be moving to MetLife. So if you're enrolled in the short-term or long-term disability, please complete the MetLife form. When you get to the short-term and long-term boxes, check the box and right next to it. Keep the same, or if you're enrolling for the first time, indicate that on the first page of the MetLife form. So short-term disability is available on the 14th day of illness, hospitalization, or accident. It covers 60% of your pre-disability earnings up to $1,000 a week. And this benefit duration is 11 weeks. And I will go over the pre-existing limitation at the end. Long-term disability starts at the 90th day or at the termination of the short-term disability. Again, it's going to pay 60% of your pre-disability earnings, and it's up to $7,500 a month. Pre-disability earnings under MetLife is going to be base, commission, and bonus. The long-term disability lasts until age 65 or normal Social Security retirement age. Now, if you are enrolled today in the short-term or long-term disability, you have met the pre-existing limitation. If you're enrolling for the first time, it is applicable to you. So what this 312 stands for is if you saw a provider, were diagnosed with a condition, or took medication for a condition 3 months before the effective date, and you went out on leave for that same condition in 2021, it would not be a compensable or paid event. EAP, so all employees, regardless if they enroll in benefits, have access to the Employee Assistance Program. So it provides 3 face-to-face visits. Aside from the visit, you have concierge services, expert or professional referrals. You also have discount videos, self-help videos, and classes that you can access on the portal. The AFLAC plans are changing a little bit. So we do have now group AFLAC plans. So the accident, critical illness, and hospital plans are now going to be at a guarantee issue. They are going to be less expensive than what you're paying today with more coverage. In your packet, you should have received an AFLAC form as well. If you'd like to review your current AFLAC and change the new AFLAC, please contact Jose Scheineman, and he can have a one-on-one with you and transfer those existing policies and save you money immediately. Pet healthcare is still available. So this is provided by United Pet Care. They contract with veterinarians throughout Arizona and throughout the United States to give you discounts for veterinary needs for your dogs, cats, birds, reptiles, pocket pets. There are no breed exclusions or no pre-existing limitations. You also, on this one, you have to enroll online. You should get a flyer also with more information. Follow the directions on the flyer, enroll online, and it is a payroll deduction as well. Legal Shield and ID Shield. So for the legal plans, it's a suite of attorneys you have at your disposal for many things. Simple will preparation, power of attorney, 24/7 services. And then the ID Shield is identity theft protection. So they'll monitor your credit, the internet, and including the dark web to make sure your information is not being utilized by someone else. All right, next steps. Everyone should complete an enrollment form by the due date, which is going to be December 14th. Make sure you submit that to your HR representative at CBR. If you're enrolling in the high deductible health plan, you do not need to open a new UMB account if you already have it open. If you are enrolling for the first time and you would like to open it, keep in mind the annual maximum is $3,600 as an individual and $7,200 as a family. So that's the maximum pre-tax that you could put into that HSA account. If you're 55 plus, you can add an additional $1,000. Keep in mind, if you are Medicare age and enrolled in Medicare, you cannot enroll in an HSA account or open an HSA account. You can use dollars that are in there to pay for medically qualified expenses for medical, dental, vision for yourself, spouse, and dependents, but you can no longer add money to an HSA if you are enrolled in Medicare. Also, if you are covered by a spouse or domestic partner's plan or Access or TRICARE, and you have co-pays before your deductible, you are also going to be excluded from adding money to an HSA. Keep that in mind when reviewing all of your medical options. Again, we need an enrollment form from everybody. If you're going to be transferring your services, life disability from Unum to MetLife, we also need that form completed as soon as possible and submitted. If you're enrolling the house flexible spending account, there's also a TASC form that needs to be completed if you already haven't done it. Some of you may have already been completed that form. You do not need to re-enroll for 2021. If you have any questions, please don't feel free to contact your HR representative at CBR. Thank you.